All right. So your pain is going to get worse. Today going to be post-op day 1. Post-op day 3 and 4 is going to traditionally be the worst for you from a pain perspective. And that's just because as the anesthesia really starts to burn out of your system, your body is going to experience more and more of that pain. You're going to have a little bit more swelling tomorrow and the day after, just because you're going to be able to move more. As you move more, the knee is going to respond to that via swelling. And as it swells more, then you're going to have pain. You're going to play this kind of this like undulation cycle where it gets worse, it gets better, it gets worse, it gets better. Getting worse being the pain gets worse because the swelling gets worse. Then you're going to address the swelling via the ice, via the rest, the elevation, kind of the old motto being rest, ice, elevation, and compression. Now we focus on a little bit more what we call peace and love. I can go through that later, but essentially what you want to do is you want to work into a pain-free range of motion. In your case, we're going to want to do a lot of frequent short bursts of mobility. And what I mean by that is I don't want you for the next 10 days, I don't want you to focus too much on how far you can walk. A lot of patients tend to have a kind of some arbitrary goal. I want to walk, a standard walk I've normally done. I want to go a mile. I want to go a half a mile. Whatever that goal is, just for the next week, 10 days, let's just table that. And what I want you to focus on for the next 10 days is frequently moving throughout the day. And the frequency I want you to focus on is an hour. Every hour, I want you to do a minimum of a lap, in the home, outside of the home, it doesn't really matter. Not too far, but I want you to stay relatively close, and you're gonna do a lap every hour that you're awake. The first couple laps of the day, the first couple hours of the day, that is, it's gonna feel relatively inconsequential. By the end of the day, by 4, 5, 6 p.m. at night, you're really gonna start to feel that swelling kick in. When you're not walking, you're gonna do a lot of on and off icing, and we're gonna focus on some of that there. Good. All right, so here's a protocol I would do for you specifically that we talked about a little bit earlier for the first 10, 12 days. Just in this hypothetical example, we're gonna start at the top of the clock, top of the hour. You are going to start at the top of the hour with the ice on your knee. The ice just got on your knee, and you're gonna have that ice on for about 20 minutes. And then have this guy.
Yeah, I have a timer on that.
Strapped all around.
It'll go 20 minutes.
Yep, for the 20 minutes. When the 20 minutes is done, you're going to take the wrap off, and you're gonna do nothing. You just did was you froze that leg. You got it cold, you slowed down some of that lymph fluid, you reduced some of the swelling, but the last thing you wanna do is you wanna start walking on a cold joint. We don't want that. But instead what we're gonna do is we're gonna wait about 4 to 5 minutes for that leg to naturally just heat back up to room temperature, get that blood flow going again. While you're waiting in that 5 minutes, you can take your leg. By the way, when it's icing, I want your leg elevated. When you're that 5 minutes, that warm-up period, you can bend the knee and just get a little bit of motion in there. So now we've gone, say, 25 minutes through the clock. Now we're gonna spend around 5-10 minutes or so going through the exercises that you and I talked about a minute ago.
Okay.
Just to, again, we're gonna
When you say elevated, is elevated level?
Just here.
Okay, because I have those pillows that elevate it even more.
Not necessary.
But they kind of put tension on the back of your knee.
Puts tension on the back of your leg. It's not necessary. The risk versus reward, the benefit on it is low.
I have the one that has a little cutout, which winds up making it look like it's elevated more than it is.
Yeah.
That's the one that's out there on that, behind me on that hassock.
Yep.
Yeah, that one.
You can do it if you like. You're perfectly fine just keeping it where it is here.
Okay.
Now that the ice has been on for about 5 minutes or so, you are going to, again, go through some of those exercises, those mobility exercises that you had just done. The one where you're going to be pumping the leg up and down, doing lots and lots of ankle pumps to just facilitate a lot of blood flow as well as prevent any sort of blood clots. That's, of course, we don't want any blood clots.
That was the reason for that other thing that's that black thing. It's for pumping your leg. I don't know where it is, but it's complicated. And I also have a TENS unit, which I don't know what to do with that.
Not much benefit.
Yeah.
I can show you what to do with it, but for now, focus on those. Now we're going to say another 5-10 minutes or so have gone by. This is where you're going to get up and actually do the walking portion. The most important exercise that you can do the next 10 days, 2 weeks, is going to be to walk. There is no better exercise functionally than to just get you up and walking. By the way, everybody always asks, when can I walk without the walker? The walker is not required. It is there for pain relief. You could walk right now without the walker and you'd be perfectly fine. You are not going to hurt the surgery.
I have walked without the walker.
You're not going to hurt the surgery. It might hurt you. It might not feel very comfortable to you as the patient, but you're not going to hurt the surgery.
We'll see the next couple days.
It will get worse tomorrow if you don't use the walker. Most patients tend to ditch the walker around day 8 to day 12.
Okay.
Give or take. Now, once you've done your walk, you're going to have another, say, 10, 15 minutes or so have gone by. Then when you're done, you've just done all of these exercises. You've just heated up the leg. It's nice and blood flowing. What I don't want you to do, the worst thing you could do is immediately sit down and put the ice back on it. Basically now, we're going to go in reverse order. You're going to go back to the chair, and you are just going to rest. You are just going to let it naturally slow down that blood flow. We want to slow down that lymph fluid and just get the body to respond favorably. Once you've waited a good 5-10 minutes or so, at this point you're probably coming around the top of the hour. Once it's rested and it's cooled down at room temperature, that's when you're going to put the ice back on, and that's when you're going to kind of restart that whole hour cycle all throughout the day from start to finish for the next 7 to 10 days. It's going to be a lot of up and down.
Okay.